My name is Kelly Morrow. I am the reimbursement manager with Midwest Physician Anesthesia. We're located in Central Ohio. Our practice consists of both physicians and CRNAs. We have approximately 140 providers that provide anesthesia services with 3 large hospitals and 5 surgery centers. I personally assist with denials and appeals, so I do access PHIcure daily, reviewing explanation of benefits from the payers, also utilize the timely filing option in there, which creates the letters. I also use the basically to support that we did submit the claim, so I will use the submission reports. The fact that it integrates so well with our billing software, we can identify the rejections quickly, make the corrections, and get them sent out. Being able to log in and take a quick glance at the dashboard that's right there, I can look at any trends that might pop out. Usually, with us being a hospital-based provider, we depend on the facility to provide claim or insurance information, so it's not always accurate, and we can identify those rejections and get the insurance corrected and get the claim sent out cleanly. Well, like I had mentioned previously, it is a quick glance at the total volume that's being sent by payer, and we've had an experience in the past that we identified that our claims were not being sent, and that was being an issue between our billing software getting the claims to PHIcure. So by identifying that quickly, we were able to work with our billing software and get the problem resolved. That way our claims were being sent out a lot faster. We don't have a lot of rejections and trends, but like I had mentioned, it's easy to identify the ones that typically have to do with the member's ID number being incorrect. Just the fact that it's user-friendly and all of our staff has access to PHIcure, and being able to, when we get the rejection in our billing software, we can go into PHIcure if we need to address any deeper issue, get that resolved. It's just a very smooth versus going to an outside clearinghouse where it's more difficult to communicate. If we have questions or need a further explanation, PHIcure is easy to contact. Since we are hospital-based, we're so dependent on the facilities to provide us with accurate information when it comes to member ID and insurance. That's probably one of our biggest challenges. Again, I also utilize the explanation of benefits to identify a more specific denial reason so that we can appeal them appropriately. I like the fact that I can download the EOB without actually printing it, and it'll just go right into our system. I utilize the option to create an Excel spreadsheet to check off or to audit our operating room schedules. That's how we make sure that we capture all of our charges. So it's easy to go in and create that spreadsheet by data service. You can run reports either in a broad manner or get very specific on what you're actually looking for. Just that it's user-friendly, that it's clean. The information, like I said, you can be very broad in what you're trying to get out of the system to being very specific. The other thing is that we also do billing services for other providers. So your data is not intermingled by practice. You can select when you log in which practice you want to look at.